Childbirth is not only a physiological event, it's an emotional, cultural, and medical journey. For thousands of years, women gave birth naturally. But with the advancements in modern medicine, C-sections have also become part of the childbirth process. Today, one of the most debated questions among mothers and healthcare professionals is this: is vaginal birth better, or is C-section safer? In this presentation, we will explore both types of birth, physiologically and psychologically, individually and socially. We'll back our discussion with scientific data and enrich it with expert insights. Vaginal birth, the body's natural plan. Vaginal birth is when the baby is delivered through the birth canal as a result of uterine contractions and cervical dilation. This method relies on the natural biological design of the female body. In fact, nature has prepared women for this process through an intricate and miraculous system. During vaginal birth, the hormone oxytocin is released, not only to regulate contractions, but also to help establish bonding between mother and baby and support milk production. Endorphins released immediately after birth help ease both physical and emotional stress. The World Health Organization, WHO, defines vaginal birth as the ideal conclusion to a healthy pregnancy. WHO also urges countries to reassess their birth protocols to reduce unnecessary C-sections. Scientifically proven benefits of vaginal birth. Lower surgical risk. Since there's no surgery involved, the risks of anesthesia, excessive bleeding, and infection are significantly lower than in C-sections. Immune support from natural flora. As the baby passes through the birth canal, it is exposed to beneficial bacteria that help develop gut health and strengthen the immune system. Support for respiratory system. The squeezing of the chest during passage through the canal helps expel fluid from the baby's lungs, reducing the risk of breathing difficulties. Immediate skin-to-skin contact. The baby is often placed on the mother's chest right after birth, which promotes bonding and milk production through the hormone prolactin. Emotional empowerment. Many mothers report a sense of strength and confidence after successfully completing vaginal birth. This can also lower the risk of postpartum depression. Challenges and risks of vaginal birth. Of course, vaginal birth isn't always smooth. Here are some potential challenges. Length of labor. Especially in first-time births, the active labor process can last 12 to 18 hours, requiring physical and mental endurance. Pain. While pain management options like epidurals exist, parts of labor can still be intensely painful. Tears and episiotomies. Some deliveries may involve tearing in the perineal area or require an episiotomy, both of which take time to heal. Pelvic floor weakness. Some women may experience urinary incontinence or pelvic floor issues after vaginal delivery. Emergency C-section risk. If the baby's heart rate drops or labor stops progressing, emergency surgery may be needed. Section birth. The role of surgical intervention. A C-section involves surgical incisions through the abdomen and uterus to deliver the baby. Historically, it was reserved for life-threatening situations. Today, however, many C-sections are performed electively, even without medical necessity. The American College of Obstetricians and Gynecologists, ACOG, recommends C-sections only when medically necessary, as surgical births come with risks. When C-sections are medically necessary. Breech position, baby is feet first. Placenta previa, placenta covers cervix. Uterine rupture risk, multiple pregnancies, twins, triplets, maternal heart disease or medical conditions, irregular fetal heart rate or distress. In these cases, C-section is the safest option for both mother and baby. Risks and long-term effects of C-section. Longer recovery time. Recovery can take 4 to 6 weeks, during which movement is limited and caring for the baby may be more difficult. Infection and clot risks. Surgical incisions can lead to infection, and rare but serious complications like blood clots can occur. Impact on future births. Vaginal birth after C-section, VBSE, may not always be safe. Uterine adhesions or rupture are possible in subsequent pregnancies. Delayed bonding, post-surgery recovery and anesthesia may delay skin-to-skin contact between mother and baby. Current global statistics. According to the World Health Organization, ideal C-section rates should be between 10 to 15% of all births. However, in countries like Brazil, Turkey, and Egypt, rates exceed 50%. According to CDC data from 2023, nearly 1 in 3 births in the U.S. was delivered via C-section. This suggests that non-medical factors like fear, convenience, and social influence are contributing. Expert opinions and scientific studies. Dr. Sarah Buckley states that the hormones released during labor are essential not just for delivery, but for emotional bonding and postnatal well-being, and that surgical birth may interrupt this hormonal cascade. A 2018 global study published in The Lancet concluded that unnecessary C-sections increase healthcare costs and elevate risks of complications. A study by University College London found that children born via planned C-section had a 20% higher risk of developing asthma by age 5. Social pressure and birth rights. Many women feel judged by their method of delivery. In some societies, being a good mother is wrongly associated with having a natural birth. But each woman's body, mental state, and circumstances are unique. The key to a positive birth is a well-informed, supported, and empowered mother, regardless of delivery method. Conclusion: which birth method is best? The truth is simple. The best birth method is the one that's medically appropriate, safely performed, and chosen by the mother with full knowledge and consent. Vaginal birth may not always be safe or possible. C-sections are not always easy or ideal. What matters most is respecting the mother's body, mind, and choices. If you found this video helpful, please like, comment, and subscribe to our channel. Stay healthy, and let's honor the miracle of birth, no matter how it happens.